Hello everyone. Today we'll be talking about difference between angina and myocardial infarction or MI. I think this is one of the favorite question of examiners, including me, to ask about this difference. Be it the theory examination or the practical examination or the viva. This is something which has been asked by almost every examiner of medical surgical nursing or cardiovascular nursing. So, in this presentation, we'll be talking about what is the difference between angina and myocardial infarction. So, basically, talking about the outline, I'll be covering about difference between angina and MI on the basis of causes, pathophysiology, seriousness, what precipitates the pain, how the pain is relieved in both of the conditions, about cardiac biomarkers, and the difference on the basis of treatment. So let's start one by one. First of all, difference between angina and myocardial infarction on the basis of cause. So it has been seen that in angina, there is narrowing of the coronary arteries. So जो arteries heart को supply करती है, we have coronary arteries. Angina में उन arteries में क्या हो जाता है? They will be narrowing because of plaque formation, because of atherosclerosis. You can also see in the picture what happens. The plaque will be formed in the coronary arteries, and because of which the size of lumen will be less and the heart will be getting less blood supply. Whereas in myocardial infarction, what happens? It results from blocked coronary arteries. So when there is complete blockage of the coronary arteries, this might lead to myocardial infarction. Next differences on the basis of a bit pathophysiology. तो क्या देखा गया है in the angina? Myocardium receives low oxygen from narrowed arteries. As we have seen that coronary arteries will be narrowed down, and because of which the oxygen supply to the myocardial tissue will also be less. Whereas in myocardial infarction, because of complete blockage of the coronary arteries, no oxygen is received due to that, and because of which what happens, ischemia and infarction occurs. Infarction means there will be necrosis and cell death. So this is, like you can say, this is the advanced stage of angina. The third difference is on the basis of seriousness. So angina is less serious as compared to myocardial infarction. Okay, so we can also say that initially the person might have episodes of angina, but afterwards, with this, it can lead to more serious condition, that is myocardial infarction. Then the next difference is on the basis of duration of chest pain. So it has been seen that in angina, the chest pain will be of shorter duration, but in myocardial infarction, the chest pain might be of longer duration. It might be approximately 30 minutes or more than 30 minutes. Whereas in angina, it might be of 3 minutes, 5 minutes, or maybe 8 minutes, lesser than the pain which is there in the myocardial infarction. Then the difference on the basis of precipitating factors. किस चीज की वजह से, किन factors की वजह से anginal pain या chest pain हो सकता है, और किन factors की वजह से myocardial infarction हो सकता है. So it has been seen that the angina is precipitated by exertional activities, most commonly, such as if a person is doing certain kind of exercises, or the person is under stress, or there is changes in the temperature. So these all factors might lead to the episodes of angina, although there are exceptions like unstable angina, a type of angina which we discussed in the previous video, can happen even at rest. Whereas in myocardial infarction, usually it has been seen that it might occur even when a person is resting. So these are the precipitating factors differentiating angina and myocardial infarction. The next one is how the pain is relieved. So anginal pain can be relieved by rest or by taking the nitrates such as nitroglycerin, sorbitrate, etc. Whereas myocardial infarction, the pain in myocardial infarction will not be relieved by just rest. The patient will be needing opioids, that is morphine, for the relief of myocardial pain, myocardial infarction pain. Then we have the biomarkers, cardiac biomarkers. So it has been seen that the cardiac biomarkers, that is troponin T, troponin I, they are the more specific cardiac biomarkers which might be raised if a person has myocardial infarction, whereas the cardiac biomarkers may not be elevated, might not be changed when a person has the angina. The next one is treatment of myocardial infarction and treatment of angina. So for the management of angina, usually nitroglycerin, aspirin, and anticoagulants might be used. But for the management of myocardial infarction, you might have to use a regime known as MONA, which is morphine, oxygen, nitroglycerin, and aspirin. The person might be requiring the thrombolytic therapy in the form of tissue plasminogen activators, tenecteplase, retiplase, alteplase, etc. The person might be requiring the cardiac catheterization, where the PCI, that is percutaneous coronary interventions in the form of angioplasties, balloon angioplasty, stent placement can be done. Or even if a person has more severe problem, like not just one coronary artery, but there are more than 3 coronary arteries, known as triple vessel disease, the person might be advised to undergo the surgery, which is CABG, coronary artery bypass grafting. So it is more severe as compared to angina and will be requiring more advanced form of the treatment as compared to the angina. So in a nutshell, we saw the difference between angina and MI on the basis of causes, जहाँ पे क्या है, कोरोनरी आर्टरी में अगर नैरोइंग है तो एंजाइना होगा, बट कोरोनरी आर्टरी अगर ब्लॉक्ड है तो मायोकार्डियल इंफार्क्शन होगा. देन वी आल्सो सॉ इन द फॉर्म ऑफ पैथोफिजियोलॉजी कि इसमें एंजाइना में क्या होगा, बिकॉज ऑफ नैरोड कोरोनरी आर्टरीज द ऑक्सीजन supply will be less towards the myocardium, whereas in the myocardial infarction there will not be oxygen supply, leading to the infarction or cellular death of myocardium. Then the angina is more severe as compared, the myocardial infarction is more severe as compared to angina. And the anginal pain is precipitated by exertional activities, whereas the myocardial infarction is precipitated by like it is precipitated even at rest. So you cannot just say that exertion ki wajah se hi hoga. Even a person who is taking rest might have the myocardial infarction. Then angina can be relieved by rest or nitrates, whereas the myocardial infarction will be requiring opioid analgesics for the management of pain. Cardiac biomarkers might not be raised in angina, but might be elevated in the myocardial infarction. The angina requires treatment in the form of aspirin, nitroglycerin, or anticoagulants, whereas in myocardial infarction, you might have to go for morphine, anti-G, aspirin, cardiac catheterization, thrombolytics, or the coronary percutaneous coronary interventions, or even the surgery, which is coronary artery bypass grafting, depending on the number of cells and the like percentage of blockage of coronary arteries. So that's it for today. Do you know any other difference other than the one which I have covered? So you can always write in the comment box. Thank you so much.